2020 candidates Bill de Blasio and Robert O'Rourke, better known, of course, as Bob. Uh, okay, fine, I'll call him Beto, but it's not going to last much longer. They got into a little bit of an exchange on Twitter over Medicare for All. Now, O'Rourke put out this video on his Twitter page, so this isn't dug up or anything. This is him campaigning for himself, showcasing, hey, this is what I think about healthcare. Put out a video of him lying about what Medicare for All does, and Bill de Blasio called him out on it. So first, here's the video that O'Rourke put out.
But for those who have private employer-sponsored insurance, or members of unions who have fought for health care plans, sometimes in lieu of wage increases or other earned benefits, and have a health care plan that they like because it works for them and their families, they'll be able to keep that. So we get to universal guaranteed care while still preserving choice, and we avoid the false choice between the status quo, what we have today, the Affordable Care Act, and something that would force tens of millions of Americans off of private insurance and towards Medicare.
Okay. First of all, I don't know why this guy is still in the race. He offers nothing. He is an empty shell for corporate interests. So this video went along with the tweet that said, we don't have to make the false choice between a status quo where millions of Americans are uninsured and millions more can't afford their prescriptions, and a plan that would force 180 million Americans off their insurance. That's why I support Medicare for America. Okay, so in case you don't know, Medicare for America is not Medicare for all. Because of Medicare for All's immense popularity, there are a lot of other plans out there that are trying to adapt the Medicare for All name into a different plan that still serves corporate interests. So Medicare for All, as you saw O'Rourke explain, still keeps private insurance for millions of Americans. And his excuse here is, oh, it would force 180 million Americans off of their insurance. Yeah, onto better insurance that has no out-of-pocket expenses, costs nothing, doesn't make them stuck to an employer, gives them freedom of choice for any doctor, because Medicare for All puts everybody in the country on the same plan. So you still get the same doctor, same hospital, same services, more coverage in most cases than you currently have through private insurance, and the freedom of not having to be stuck to an employer. And maybe you want to start a business. You still have health care. Maybe you want to hire people. They'll have health care because it's through Medicare for All. But Robert O'Rourke, is defending the status quo and pretending, oh, this is the real choice where everybody has the freedom to choose a private insurance company or choose Medicare for All. But in choosing Medicare for All, if you choose the Medicare option, you have to still buy into it. So there's still out-of-pocket expenses. It's not free at the point of use. So this is not Medicare for All. This is a lie. Now, Bill de Blasio, who, to be fair, also has no chance in this race, replied to Beto O'Rourke, but did so in such a way that I had to cover it, even though de Blasio really has no effect on this race. But he tweeted out, if someone proposed a radical idea called public education today, Beto would try to warn us that 180 million Americans would be kicked out of their schools. Let's leave the lazy fear-mongering tactics to Trump. Now, this is actually a great analogy, and it's exactly right. I mean, I mention this all the time because I think it's worth pointing out that I'm from Canada, so I have universal health care. I've always had health care. I never had to think about health care. I've had surgery. I had surgery when I needed it. I mean, like one of the things that it's kind of hard to explain to Americans that don't have this experience is just the peace of mind, the freedom that I have, not having to worry about, oh, I got to pay this bill and that bill and do this and talk to this insurance company, not having to worry about out-of-pocket expenses, not having to worry about changing jobs, not having to worry about starting a business. Just the healthcare is there when I need it. I mean, it's if you grow up in the American system, I don't know what your experience is like, but I can tell from hearing other people talk about it that, from my perspective, it's insane. This healthcare system where you prioritize profits for insurance companies over the best interests, over healthcare for actual people, there is no way you can defend this system. It makes absolutely no sense, which is why when all these other countries move to a universal healthcare system, they don't go back to a private insurance-based system. Now, O'Rourke responded back to Bill de Blasio's tweet saying, "Thanks for reaching out, Bill. Just like every parent can send their kid to a public school, under our plan, every American who wants to enroll in Medicare can do so. It's the best way to guarantee high-quality health care for every single American." Now, before I go any farther, his analogy also has the built-in flaw of his plan, is that public education gets defunded. Public education, I mean, again, from reports that I read from Americans that experience public education, especially in certain districts in the country, it's underfunded. And I mean, teachers aren't being paid properly as one example, but textbooks are old, schools are falling apart. So wouldn't that same situation, wouldn't that also happen with his Medicare, Medicare for America plan, where you have a system that is still split between corporate interests and the public? So obviously, O'Rourke has has not thought out his explanation here, and Bill de Blasio came back saying, "An important debate, my friend, but the best way to guarantee high-quality healthcare is to make sure wealthy and poor people, healthy and sick people, all get the same care. To allow corporate interests to stay at the table will do the opposite. If wealthy and healthy people opt out, a public plan suffers. Working families suffer. And for the record, yes, I believe the same is true for education. Why I oppose corporate charterization." So there was no response from Beto O'Rourke after Bill de Blasio tweeted this out, because you can't respond to this. Bill de Blasio is exactly right. I mean, anybody that is still defending private insurance companies, that is against a Medicare for all system, or doesn't have a history of supporting Medicare for all, but now sees the polling and thinks, oh, well, I support it now, unless you get into power and you feel the pressure of these insurance companies and the pressure of the establishment and you give in to them because you haven't supported this in the past. Again, anybody that supports these existing plans, private insurance companies, are either corrupt or stupid. It's one or the other, because the existing system is broken. It does not make any sense, allowing private companies to continue making profits off of the back of sick people, off of denying people coverage. This is an insane system. So, I mean, there's talk about, oh, universal systems, there's rationing because everybody has to use it. Oh, there's rationing. Isn't there rationing in the American system? It's just based on wealth. If you have a lot of money, yeah, you'll have great healthcare. No one's denying the fact that if you're wealthy in America, you have good healthcare. Yeah, you will. But if you're everybody else, which is most people are not wealthy, if you're everybody else, you will not have good healthcare. Or you'll have to pay insane out-of-pocket expenses that you didn't realize you had to pay until you had to pay them. I mean, the stories are endless from how screwed up the American system is. Again, the rationing in universal healthcare systems is based around healthcare need, not based around wealth. So in the American system, rationing healthcare is based on wealth. In universal systems, rationing of healthcare is based on need. So say you have there's a life or death surgery you need. You have that surgery immediately. There's no wait list. There's no waiting 4 months for a surgery. You get it immediately. The surgery I had was not life-threatening. It wasn't major. So I was able to afford to wait a few months to be able to get my surgery. Now, if I had the choice, or if I had the ability to afford to go to the US and get that surgery, the next day, sure, I guess I could have done it. But I don't have that ability. I don't have that money to do that. Most people don't have that money to do that. So anytime you hear a story about, oh, Canadians come to America all the time to get healthcare, the only people that would do that are people that can afford to do that. So the same people that get fantastic healthcare in America because they're rich are the same rich Canadians that are going to America for maybe a surgery that's a week early or a few weeks early or a month early because they can afford to do it. So again, this is a system. The American system is based on greed. Universal systems are based on need.